Join us this Wednesday and every Wednesday between 6 and 7 on Good Morning San Diego for the KUSI Medical segment brought to you by UCSD Medical Center. Well, these days, almost everybody has a cell phone. The technology has been around for almost 30 years. And after years of studies, there is growing evidence that people who use their cell phones often and over a long period of time could increase their risk of developing a brain tumor. This morning, Dr. Santosh Kesari, Director of Neuro-Oncology at the Moores UCSD Cancer Center, is here with the latest findings and to tell us about a brain tumor program that is going on right here at home to help patients. Good morning.
Good morning.
You know, we hear studies, it seems like there's one out every few months. Cell phones cause brain cancer, cell phones don't cause brain cancer. What is a person to believe?
Well, Sandra, that's a very good point. There are actually a variety of data that has come out over the last 10 years, epidemiological data, that show, in fact, that there may be a slight increase in the risk of brain tumors, benign and malignant, and it's related to time. The reason that the studies are a little confusing is because time is a big issue. So the longer you use it, the longer duration, the older cell phones having higher energy levels can potentially increase the risk.
What is it about cell phones? Is it the radiation from the cell phone? What is it that can possibly cause an increase in brain tumors?
We think it's the radiation. It's called non-ionizing radiation. It's not the same type of radiation that clearly associated with cancer.
Non-ionizing radiation.
It doesn't damage the DNA of cells as the ionizing radiation.
When you say a slight increased risk of brain tumors, what is that risk?
It's hard to quantify. It's an increased risk above normal that occurs after 10 years of long-term exposure to cell phone use. And these are studies that can't be done in the United States. These are done in small population-based studies, such as in Denmark and Finland, where patients are followed for the lifetime in the epidemiology.
As a parent, I use my cell phone. Everybody has one, but my children have cell phones. I have a 12-year-old who has a cell phone, and I think a lot of parents out there give cell phones to their kids as a security blanket, too. You know, you want to be able to get in touch with them after school or in case of an emergency. You have children. Do your children have cell phones?
No, they do not. And this is exactly the reason that I will avoid it as long as possible. Because we don't know the untoward effects of this low amount of radiation for a prolonged period of time. And I think potentially from the data out there, the risk may be even for smaller children with smaller heads and less distance from the radiation to the brain.
All right, what about most kids who have cell phones, they use their cell phones to text, especially teenagers. What about the risk? Is it just putting the phone up to your ear or texting and holding your phone? I mean, people sleep with their phones.
That's a very good point. It's not just brain tumors that these studies show an increased risk, but also other types of cancers, benign and malignant, skin cancer and acoustic neuromas. So I think there's even other effects of migraines and cardiovascular disease. There's all kinds of health effects that can potentially occur with cell phone use that we are unclear about.
And I've never heard that before. So you're saying that you can increase your risk possibly of skin cancer or heart disease by having a cell phone?
Yes, potentially, depending on how you use it, where you use it, etc.
So tell us, you are with UC San Diego, a medical center. Tell us about the studies that you're involved in.
So what we focus on is mainly treatment of patients with brain tumors. So we help diagnose, we treat with surgery, radiation, and chemotherapy, and we try to develop new treatments for brain tumors using our understanding of the biology of these tumors. So we know that everyone's tumor is a little different. We try to understand the genetics of the tumor and use that information to tailor treatment or personalized treatment for brain tumors.
What would your advice be, doctor, to people who have, these are some images here. We've got some pictures here on the screen. Explain, these are brain tumors, or how is this all related to what we're talking about?
Well, you know, for many decades, the treatment of brain tumors was very bad, and patients died within a year. But for the first time, because of our understanding of the disease biology, we can make tailored drugs that treat patients, and some of these patients respond. As you can see on this MRI,
right.
that patient on the left side at baseline, and then after a month of treatment with a new drug, a dramatic shrinkage of the tumor.
So there are advances that are being made that are less disfiguring for patients. And what's this that we're seeing? These are just images?
Yeah,
that
these are different ways to do better surgical treatment of brain tumors by understanding where all the normal fibers are, and with the different colors showing the different normal fibers that run through the brain, and avoiding it by only focusing on the tumor.
And you are developing a brain tumor center that is going to be right here to improve patient treatment.
Absolutely. So we want to, this is a very bad disease, and it requires the help of multiple different disciplines, surgeons, oncologists, radiation therapists, social workers, psychiatrists, etc.
And quickly, back to the cell phone. Do you have a cell phone?
Yes, I do.
Okay, what would you advise people out there that are probably a little freaked out, especially the kid factor that you just explained to us that have cell phones? What is your advice?
I think, as with anything, you know, cell phones can also be bad when you're driving and get into an accident.
Sure.
So I think you have to use caution and use minimal use, and try not to use wireless headsets, and use the regular phone as much as possible when you're at home. Many people use cell phones at home when you could use your own phone.
Dr. Santosh Kusari, thank you very much for coming in. It was a pleasure to meet you.
Thank you.
You've succeeded in freaking me out this morning.